Dear student, welcome to this lesson on diet and fevers. Fever may be a symptom of an underlying disease, or it may be no more important like a sore throat, presence of cough, or sometimes fatigue and joint pains. But whatever it may be, fever needs to be medically handled and treated with the right type of diet so that the convalescing period is quick and without any complications. In this lesson, you will understand the term fever, its causes and the types, know the need for good nutrition and dietary recommendations essential during fever. Let us first get familiar with what is a fever. As you know, an increase in body temperature is fever, and by definition, it is an increase in set point that allows body temperature to be regulated at a higher level. A set point is the temperature around which the body temperature is regulated. In this lesson, you will understand the term fever, its causes and the types, know the need for good nutrition and dietary recommendations essential during fever. Let us first get familiar with what is a fever. As you know, an increase in body temperature is fever, and by definition, it is an increase in set point that allows body temperature to be regulated at a higher level. A set point is a temperature around which the body temperature is regulated. Technically, any body temperature above the normal, which is 98.6 Fahrenheit or 37 degrees Celsius, is considered as fever. Fever is not considered medically significant until body temperature is above 100.4 Fahrenheit or 38 degrees Celsius, which is a temperature considered to be a fever by medical professionals. Anything above normal but below 100.4 degree Fahrenheit is considered a low grade fever. Fevers of 104 degree Fahrenheit or higher may be dangerous and demand prompt medical attention, as they can result in delirium and convulsions, particularly in the vulnerable groups, namely infants, children and the elderly. Fever is a classic sign of infection resulting in elevation of body temperature above the normal. Fever is a result of an immune response by the body to a foreign invader. It may occur in response to any inflammation or sometimes even unknown causes. The foreign invaders can be exogenous agents like bacteria or fungi. The endogenous reactions can be like antigen-antibody reactions and so on. During infections, phagocytes are activated in the bone marrow and the body releases a protein, namely endogenous pyrogen or EP. Pyrogens signal the hypothalamus in the brain to increase the body temperature set point in order to help the body fight off the infection. The EP mediates the formation and release of prostaglandins, which raises the body set point. Now, prostaglandins are a group of naturally occurring chemically related hydroxy fatty acids that stimulate contractibility of uterine. They lower blood pressure, help in regulate acid secretion and also maintain body temperature. During fever, heat producing and heat sparing mechanisms elevate body temperature with a rise in the normal temperature. There is vasoconstriction and the patient has chills and complaints of feeling cold. With the removal of the stimulus or the foreign matter, the set point declines. Heat loss mechanisms like sweating increases respiration and vasodilation restores the normal body temperature. Now let us see what is the relationship between nutrition and infection. As fever is a classic sign of infection, the interaction between nutrition and infection should be understood. The relation between nutrition and infection, that is, nutritional deficiency lowers immunity or resistance to infection, and in turn, infection aggravates the existing malnutrition or deficiency. Depending on the nature and severity of infection and the previous nutritional status of the individual, nutrition needs assumes significance. The nutritional needs which increases during infection can be the stress relation, which induces a catabolic response, and there is loss of nitrogen, magnesium, potassium and zinc. The body's basal metabolic rate is increased. There is anorexia, therefore food intake decreases. There can be nutrition losses which may be increased due to vomiting, diarrhea and increased perspiration, and malabsorption interferes with the normal nutrient utilization. Now let us move to see what are the signs and symptoms of a fever. A fever can cause a person to feel very uncomfortable. Signs and symptoms of a fever include temperature which is greater than 38 degrees Celsius in adults and children, shivering, shaking and chills, headache, aching muscles and joints, intermittent sweats or excessive sweating, rapid heart rate or palpitations, skin flushing or hot skin, feeling faint, dizzy or lightheaded, eye pain or sore eyes, weakness, loss of appetite and fussiness, which is commonly seen in children and toddlers. These are the general symptoms, but it can differ according to the specific type of fever. Before you understand the different types of fever, you should know the metabolism in fevers. The metabolic effects that take place during fever is proportional to the elevation in body temperature and the duration of the fever. The metabolic rate rises to 13% for every degree Celsius rise in the body temperature. The increase is also noted during restlessness and therefore a high energy need is required. There is decrease in the glycogen stores and adipose tissues. There is increased catabolism of proteins, especially in typhoid, malaria and poliomyelitis. The increased nitrogen wastes place an additional burden on the kidney. Accelerated loss of body water owing to increased perspiration. There is increased excretion of sodium and potassium. Understanding the metabolism, now we will understand what are the different types of fever. Fevers may be acute or short duration, sudden in onset like cold, tonsillitis, influenza and typhoid. Fevers can be chronic or for a long period of time as in tuberculosis. Or the third type can be an intermittent fever which is seen in malaria. Now going to the different types of fever, let us see typhoid or acute fever as the first one. Typhoid is one of the most common communicable diseases that is caused by the bacterium Salmonella typhi. It is also called as enteric fever and spreads easily through contaminated water, unhygienic food and drink. Salmonella typhi is passed through the urine and feces by the infected people, and when sewage water gets mixed with drinking water, the organism is transmitted. Sometimes when an individual consumes any food or water handled by an infected person also, the bacteria may be transmitted. Now what are the symptoms of typhoid? Usually for typhoid, the incubation period for the bacteria is 7 to 14 days and hence it takes 1 to 3 weeks time for patients to develop typhoid symptoms after exposure to the bacteria. The duration of the disease is 3 to 4 weeks and depending on the severity of the disease, the symptoms can be mild or severe. The usual symptoms are headaches, constipation or diarrhea, high fever, lethargy, poor appetite or anorexia, enlarged spleen and liver, rose-colored spots on the chest congestion, abdominal pain, fatigue, chills, generalized pain and weakness. Typhoid fever is characterized by ulceration of the intestine, which is referred to as Peyer's patches. Diarrhea is another characteristic symptom. These symptoms interfere with absorption and this causes unavailability of nutrients. If not controlled in early stages, there are often excessive changes in liver, gallbladder and bile passages. Now, how is typhoid diagnosed? The diagnosis can be through the complete blood count or CBC, which will show an increased white blood cell count. The second type of test is blood culture, which is done during the initial phase of the disease, which will show the presence of Salmonella typhi bacteria. The third is an ELISA, which is a recent diagnostic test. ELISA urine test is done to look out for the bacteria causing the disease. And then sometimes a fluorescent antibody study can be done. In this study, any substances that are specific to the bacterium are looked for. Platelet count test is usually done. Platelet count in the case of a person affected by the disease is usually low, and sometimes a stool culture can also be used for diagnosis. The stool culture is done to determine the presence of the bacterium in the feces. Nowadays, the use of antibiotics has shortened the course of the disease. However, the length of convalescence is to a large extent dependent on diet therapy. The age-old practice of starving a fever leads to prolonged convalescence and causes precipitation of acute deficiency diseases. The principles of diet should be a high calorie, high protein, low fat and a low fiber diet. Now let us see the nutrients one by one. Calories. The calorie intake should be increased by 50%. It can even go up to 3000 to 4000 kilocalories. The calorie and protein content of the diet should be adequate to counterbalance the increased metabolism and loss of nitrogen. Protein. An increased intake of protein may be 2 grams per kg body weight, which amounts to 100 to 120 gram of protein, and an increase in energy requirement is recommended. The protein content of diet can be increased by including eggs, milk in a soft custard form. Carbohydrates. Carbohydrates in the form of simple sugars are added to liquids. Lactose is well tolerated and does not have such sweetness as that of sucrose and cane sugar. Well-cooked cereals and milk toast are well tolerated. Milk is an excellent liquid food providing calories, protein, certain vitamins, minerals and also fluid. Now we move on to the requirement of fat. Fat is recommended to be low, especially oily foods and deep fried foods, as they are not well tolerated during fevers. Fever increases vitamin requirements, especially vitamin C and B complex. B complex vitamin requirement increases because of increased energy intake and energy metabolism. Vitamin C is an antioxidant and required for collagen formation for healing of ulcers in the intestine. Therefore, during convalescence, vitamin requirements are supplemented. The diet should be low in fiber to prevent intestinal irritation. Butter, honey, ice creams, gelatin and lactose may be included. Fluids are of major importance in the treatment of acute infections. Any fluid that appeals to the patient can be included. As a rule, very sweet liquids are not appealing and may cause gastric disturbances. Consumption of liquids facilitate elimination of toxins and replaces water lost through excessive perspiration. If the patient is nauseated and vomiting and too ill to take liquids by mouth, parenteral feeding may be undertaken. Now next we move on to a chronic fever. A fever is chronic when it may continue for months and stretch into years. Tuberculosis is an example of chronic fever. Worldwide, tuberculosis still remains a leading cause of death. When a person with active tuberculosis coughs or sneezes, droplets containing Mycobacterium tuberculosis are sprayed into the air. Most people are carriers, that is, they do not become infected. For the immune system response by activating macrophages through T cell mediation leaves the organism dormant. A tubercle is formed when lymphocytes, macrophages and connective tissue form small hard nodules. The bacteria is alive in the tubercles. Tuberculosis may involve practically any organ in the body. From the tubercles, the infection may spread through the lymphatics to the lymph glands or through the blood to organs like the brain, spinal cord, bones, joints, or any organ. The risk factors for TB or tuberculosis include the following: HIV infection, low socioeconomic status, alcoholism, crowded living conditions where sanitation is poor, diseases that weaken the immune system, migration from a country with a high number of cases, and healthcare workers can also be carriers. A TB patient may experience these top 9 symptoms as you see here, such as chest pain, coughing blood, recurrent and constant cough, night sweats, fever, loss of appetite, pain in breathing or coughing, fatigue and weakness, and enlargement of lymph nodes. Now, how is tuberculosis diagnosed? Primary TB is usually diagnosed with a sputum test. Chest X-ray is also used to diagnose. The skin test or Mantoux test, in which inactivated bacteria are injected under the patient's skin, can only test for the presence of immune response and expose to tuberculosis at some stage. When tuberculosis affects organs other than the lungs, tests like CT scans, MRI, biopsy, immunohistochemical methods using antibodies may be required. The World Health Organization now recommends the expert MTB or the RI test. Dietary considerations for tuberculosis. Patients with tuberculosis should eat a very healthy diet so that they build up their immunity to fight against the disease. Tuberculosis reduces appetite, thereby reducing total food intake. In addition, it prevents the absorption of nutrients and micronutrients from the intestine. It also alters the metabolism in the individual. Patients with severe tuberculosis often lose some of their muscle mass and always appear wasted or thin. The principle of the diet should be a high calorie, high protein diet with moderate fat as tolerated by the patient. Tuberculosis and malnutrition are closely related. While malnutrition can reduce immunity and make a person more susceptible to tuberculosis, tuberculosis can also lead to malnutrition. Malnutrition has been associated with increased deaths in tuberculosis patients, and therefore adequate energy and protein are very important. The diet for chronic tuberculosis recommended should be a 2500 to 3000 kilocalories per day and a protein intake of 75 to 100 grams, or 2 gram protein intake per kg body weight is ideal. This high protein intake helps to regenerate the serum albumin levels, which are often low in a tuberculosis patient. Tuberculosis can cause loss of muscle mass, which can be avoided by taking adequate protein. A liberal protein intake of 75 to 110 gram is recommended, and concentrated sources of protein will be useful so that a positive nitrogen balance is maintained. The type of protein should be of high biological value foods, which are mainly fleshy foods. Adequate calories along with protein will help to bring down the catabolic effect in the body and help in anabolism. As you see in this diet plan, additional milk is usually included. The protein in the diet can be increased by adding non-fat dry milk. Non-fat dry milk can be added to mashed potatoes, soups and baked food. Many patients who require a high protein diet have poor appetite, and it is better to start with the patient's present food intake and gradually increase the protein and calorie intake. Foods rich in protein like meat, milk and milk products, pulses, fish and eggs can be recommended. Protein-rich drinks can also be advised, especially if the patient has a low appetite. The portions served should be of such size so that everything is consumed and there is no plate wastage. Patients with tuberculosis have been found to have micronutrient deficiencies, which may affect their immunity status. Hence, these patients always suffer from deficiencies of zinc, and supplements like vitamin A, D, C, selenium, iron and copper have to be given. In addition, iron supplements and increased dietary sources of vitamin C deficiency is frequently present, and citrus fruit intake is essential. In this condition, carotenes are poorly converted to vitamin A, and hence vitamin A supplements and preformed vitamin A diet is recommended. A high milk intake is recommended to ensure calcium sufficiency, which is needed to promote healing of tuberculosis lesions. Vitamin A is present in liver, eggs, green leafy vegetables. Vitamin B6 is present in cereals, meats and dry fruits. Citrus fruits are rich in vitamin C, and hence all these have to be included. Now we move on to the third type of fever, which is intermittent fever, and the example which we are going to see now is malaria. Malaria is an endemic disease and is one of the most widespread diseases in the world. Developing countries are at greater risk for malaria due to poor sanitary conditions and lack of knowledge on health and hygiene. Malaria is a protozoal disease caused by infection with parasites of genus Plasmodium vivax and transmitted to man by bite of certain species of infected female Anopheles mosquito. You can see this chart for an idea about how the transmission of malaria happens from the mosquito to the human being. Blood transfusion, hypodermic, intramuscular and intravenous infections of blood and plasma are the other causes for onset of malaria. The incubation period varies from 10 days to 9 months, and intermittent fever is a characteristic symptom of malaria. Malaria is characterized by 3 distinct stages: the cold, hot and the sweating stage. The cold stage, the onset of this stage is with lassitude, headache, nausea and chills, followed by an hour with vigors. Pulse rate increases. These symptoms last for quarter to 1 hour. Next is the hot stage. As the name tells you, in this stage the patient experiences burning hot sensation. The skin becomes hot and dry to touch, and the stage lasts for 2 to 6 hours. The third stage is the sweating stage. Fever comes down with profuse sweating. The temperature drops rapidly to normal and the skin becomes cool and moist. This stage lasts for 2 to 4 hours. These 3 distinct stages of malaria, namely cold, hot and sweating stage, occur intermittently with an interval of 48 hours duration. In some cases of malaria, it can even be up to 72 hours of intervals. Headache, nausea and vomiting are usually more severe in malaria. If untreated, there is a greater tendency towards development of delirium, hemolytic jaundice, which results in hypochromic anemia. Enlargement of liver or hepatomegaly and liver function may be impaired in untreated malarial cases. Now let us move on to the medical nutrition therapy, or the type of diet which is required for malaria. The principle of diet therapy is similar to that of other fevers, which is a high calorie, high protein and a moderate fat diet. As you see in this following list, in general the characteristics of a fever diet should be a bland one which is with no spices and condiments, a soft diet, that is foods which are easy to chew and those that require less mastication, a low fiber diet, the one with no complex carbohydrate, cereals, whole grains and fiber rich foods have to be avoided, a diet with more of fluids, that is more of mildly flavored clear and thin soups, strained fruit juices and beverages with milk have to be given. Feeding should be frequent with small quantities of food instead of large quantities, because the patient usually tends to waste the food. Food should be served at the right temperature. No food should be forcibly fed. As you have understood in this lesson, you will know that fever is an elevation of body temperature, and during fever the basal metabolic rate increases. There is increased catabolism and the body requires a high amount of energy, protein and carbohydrates. The fat and the fiber can be moderately given depending upon the type of the condition and the tolerance level of the patient. Now, during fever, feeding a patient the right diet in the right quantities always helps to speed up the recovery process and gain optimum nutrition. Optimum nutrition during fever is highly important because there should not be a recurrence of the fever and the patient should very quickly go into the stage of general wellness so that he can do his normal activities in a very efficient manner. I hope with these words you must have gained knowledge on the lesson, the diet during fevers.